It's good evening, all of you, and it gives me a great pleasure to be here today in the Lifeline Hospital's Facebook live session on COVID-19. To give you a briefing about, I'd like to just, before we wait for people to join us, so I just thought I will give a short intro of myself. I'm an interventional radiologist, and many of you may or may not know what interventional radiology is, or radiology in the sense. Because how I came to know first is, after finishing my radiology, when I went back to my native place, and there were all my relatives around me, and they were asking, "Sir, what have you done?" and all that. And I said, "I'm a radiologist," thinking that everybody knows what radiologists are. And then everybody said, "Oh, okay, good," and they just went off. And the next day morning, it was 10 o'clock. I was having my breakfast with my father and mother. And then I saw a couple of my people bringing their radios, and they kept waiting for me inside the house. When I went out, I was stunned because everybody is having a radio. And then I asked what was happening. They said, "No, sir, since you're a radiologist, I thought there's a problem with my radios, and you can kindly repair it and give it." So then that gave me a big laughter to me. Then I had to explain to them, radiology is not this, but then we do much more from the patient's point of view, how to image and find what the problem, where the problem is. So this is the routine about radiology, but intervention radiology is one where we do non-surgical procedures by offering people certain curative and therapeutic procedures where we can avoid surgeries. So that's where, like, for plain and simple example is for the diabetic foot patients where they go in for amputations. So we try to prevent amputations and increase the blood flow. That's how it is. So welcome Dr. Natesh and Shalini and Amit, and good to see you all, and it's a real pleasure to be with you. And so this is how interventional radiology is. So I've been practicing interventional radiology for the past, say, 20 odd years, and then my passion went up to more and more on the preventive and wellness aspect, because if you need somebody to prevent them from falling sick, because now we are currently treating patients who have already fallen sick. So if you want to treat people, or you don't want them to fall sick, so you have to focus on wellness. And there's a good amount of time window between the disease starting point and they falling sick, where we can do a lot of interventional programs and prevent them from falling sick and going to the hospitals for treatment. So, and that's where the wellness treatment gets into. So now the whole topic is on the COVID-19, where we are all very much aware that, welcome Dr. Jia Joshi, it's a great pleasure. And the COVID-19 has been a hot topic for the past 4 to 5 months, and it has really taken a great stroll. It is rampantly spread. There are too many loss of lives throughout the world, and India is also succumbing to the disease. I mean, today my whole topic is going to be on focusing on how to keep your lungs strong and healthy. Why focus on lungs alone? Because if you see the process of COVID-19, it affects certain specific parts first, and many of them are succumbing to that problem. So you all heard that people have been saying that you have to put masks, cover your face, and cover your face. Why? Because mainly this COVID virus has got a great affinity for entering through the nose and in and around the facial area. That is the phase one part of its invasion. It's an army. It's a fight between a virus and a human being. Very surprisingly, if you see, it's a nanometer or a low micron weight. If you put all the coronavirus together and if you weigh how it succumbs, it's just only 1.5 grams, not one, a couple of 1 point. So 1.5 gram micron weight coronavirus cripples a 75 to 80 kilogram human being. What a power it should have got. So what it happens is it invades the nose and there it multiplies. That is the phase one. In the phase two, it goes, if it survives, it goes into the lungs and there it starts multiplying. Hi Ashok and Yukti, welcome. Yes, Yukti has said, asked a question saying that, can you tell us what happens when the virus reaches the lungs? So exactly the timing becomes very perfect. So when it goes into the lungs, there are, I'm not going to use a lot of medical terms. I'm just trying to keep it as simple as possible. And once it goes into the lungs, see, the lungs is a beautiful organ in the sense there are the main branches of the trachea, then it goes into smaller branches, and there are small sacs called alveolar sacs. So that is where the major part of the oxygen gets transfused between the inhalation part, and then it takes the oxygen, goes to the blood vessels, and from there it supplies the entire body. So the amount of oxygen that goes, it depends all on how healthy your lung is. So these guys, the coronavirus guys, go and start invading the lungs. So once it invades the lungs, there is something called as type 1 cells and type 2 cells. And this coronavirus has got a special affiliation or affection for the type 2 cells. And an important what you call a material is secreted in these type 2 cells called surfactant. To keep it simple, if you see the bubbles, that is the soap bubbles, we play around quite constantly with soap bubbles. And some of the soap bubbles burst and some don't. It is basically because of the surface tension which stabilizes the bubbles from bursting. Once this is lost, then it collapses. So same thing happens inside the lung, because it is, when you inhale, it is the air and the fluid part. So when the surfactant is not there, the lung collapses. And these coronavirus affects the type 2 cells which secretes surfactant, and thereby it causes collapse of the lungs, which goes to the stage 3. So once when multiple alveolar cells becomes collapsed, it goes to a type stage 4, where it goes into lung failure and it starts affecting the rest of the organs, called multi-organ failure. So these are the various stages of 1, 2, 3, 4. And we've been knowing about the coronavirus only for the past 4 to 6 months. So many literatures have come up, why it is happening and how it is getting released. Now is the time when we are also learning about the whole virus part and how. So, but the surfactant, the type 2 alveolar cells, everything, we know it for quite a long time. There is absolutely no doubt that these things are there. Now only we're getting information about this. So this surfactant part has been well studied in olden days. They didn't call this as surfactant, but they call this as the lung or lung cell stimulation process. So as these things were going on, it gave me a lot of introspection to do, a lot of reading to do, and I said, why some people are dying, why some people's lungs are more affected, while some other people are asymptomatic, or many of them are asymptomatic, and they're able to fight the disease so well. Because in fact in India, if you see, the asymptomatic patient population is more when compared to the symptomatic, and the death rate also comparatively to other places, we are far, far, far better. Because so there's something good which is happening amongst us. There's something which is nice, which is knowingly or unknowingly it is helping us out a lot. So this gave me a lot of introspection, and of course we fall back into our old traditional methods. So in our traditional methods, when I start going into, because I'm a very ardent founder of the yoga and teachings and the asanas and pranayama techniques, so they must be somewhere. So that gave me a lot of introspection to be done. Then in this, if you see, before going into that, if I take, there is both the right and left lung, and if I take a person's lung, split it into small pieces, spread the whole lung into a wide spectrum of area, you know what is the area it occupies, the two lungs? It occupies roughly around 1,45,000 square feet. That is the whole thing which is comprised in both the chest of us, which helps us day in and day out. We never even realize that we are breathing day in and day out. Not even, just imagine that if you stop breathing for a few minutes, you get panicky. Luckily, I will say, God did not give the control of breath in our hands, because otherwise, in this busy world, I am sure that we would have forgotten many times to breathe, because we've been running for this, running for that. And luckily, God said these guys are going to be like this, and so we should not give this particular thing to the breath. So that is how it spreads to 1,45,000 square feet. And this 1,45,000 square feet, you know how many amount of blood, because there has to be exchange of oxygen and blood. So there are 35,000 pints of blood which is getting oxygenated every single day. So our life is going on and on and on because of this. So if there's a gross mismatch in this, we are getting into problems. So then it made me a few things, and I called 20 of my colleagues, doctor colleagues, and I said, I'm just going to give you a small exercise, and let me see whether are we all breathing normally. Because once we know that breath is the essence of life, breath, or otherwise called prana. Okay, that is what our shastras call. Prana is the Jeshta, that is the oldest, and Shreshta of life. That is what the Upanishads say. The oldest, Shreshta means the best. So if that is the best, that means, are we doing it rightly? That is what my next question was. So in order to do this, I called a couple of people and I said, can you show how you're breathing? Trust me, it was an amazing learning lesson for me, saying that more than 70% of the population do not know how to breathe normally. That was stunning. What is supposed to be our nature, we forgot. In fact, if you see, the person who normally breathes even today is a newborn infant. If you see a newborn infant, how it breathes, that is the perfect breathing. That is the normal breathing. That is a complete breathing, which in this sophisticated way of life, in the way we have grown, we have forgot that it's complete breathing. That is leading to a lot of problems. I will prove it scientifically too, how it is happening. That is why I kept this topic live, in the sense, how to keep our lungs healthy. Because I'm taking you through all these aspects, because I need to make you understand. Because I cannot straight away saying off, this is what it is and this is how you have to do, because I have to make you understand. So If you see how an infant breathes, it will first breathe by putting his abdomen out. Next, the chest wall becomes spread, and then the small intercostal and upper methods, and then it contracts. You must see it carefully how it breathes. That is a perfect level of breathing. So when I call these 20 people and I said, boss, now let us see how you're breathing. So it was awkward in the sense I could segregate them into 4 types of breathers, or 3 types, basically more. One was a high level breathing. That is, they were breathing only through the collarbone, otherwise called as collarbone breathing, which is the most worst types, which is never you should do this, because these collar type breathing people slowly go into getting into mouth breathers, and they get into the aspect of snoring. So collarbone breathing is very, very, very bad. Otherwise it is called as, in the yogic ways, higher breathing. The next group of people had a mid-level breathing. That means they were more of chest wall breathers. They use only the chest wall muscles to breathe, which is, again, it's better than the collar breather, but it is not the best, because you're not utilizing the entire part of the lung. Because the idea is you need to use the maximum capacity of the lungs to stay, because you can still, in the collarbone breathing and in the midway breathing, you can still do something called the oxygen perfusion. Still it will be 100%, but trust me, it is not using the entire lung capacity. That is something called as total lung capacity. That means when I take a deep breath, whatever amount of air that the lung can store after taking a deep breath, that is called total lung capacity. Why it is important? Because it should be somewhere between 4 to 6 liters. If you don't do that, surfactant is not produced, or surfactant is dysfunctional. So as I said to you, surfactant is very important for the alveoli to stay vacant, and your COVID affects this so that it wants to collapse. If the total lung capacity doesn't reach to 4 to 6 liters, because many of us are obese, many of us are not doing proper breathing, many of us are having lung problems, some of them are smokers, and with the lung pollution, or whatever the pollution which is happening throughout us, happening through and through, affects the lung capacity. In spite of that, we've got a wrong breathing tendency. What a sad stage of us. Everything is attacking us from all aspects. So this should not happen. At least I thought we should correct how to breathe normally. So that is what we need to do. So the second breather is chest wall breathers. The third wall breathers are abdominal breathers. So they preferentially use the abdominal breathing, which is good, which is much better than the first two. But again, we are not using the total lung. I want somebody to use a total lung. And only when you use the total lung, that is called complete breathing. So the complete breathing is an aspect of high end, that is a collarbone breathing, the midway breathing, and the abdominal breathing. So that means you have to see in how an infant breathes. That means when you take in a deep breath, you need to have the abdominal muscles to come out. It should not go in. It should come out, expand. That means the diaphragm will contract, expand the lungs. Why it is important? Because in the lungs, if you see, it's a 3-dimensional structure. You got the anterior portion of the lung, you got the posterior portion of the lung. And most of the lung is on the posterior aspect. And the posterior aspect is not utilized in any of these things, because if you start contracting the muscles, the posterior lung doesn't expand at all. So the complete breathing technique is what I'm going to focus on. For that, I need to say it's a long process, because we have started utilizing this type of breathing techniques in the wrong way. And because many people do pranayama techniques, there are a lot of pranayama courses, and they teach you a lot of pranayama techniques to see how best you can utilize it. So before going into pranayama, okay, because there are various groups of people, because there are few people who have done your techniques properly. A few people do not know about these breathing techniques. A few people know how to go about it and see how to go about the various pranayama. So you cannot go to directly a pranayama course and say, and from today I'm going to do pranayama. It doesn't work that way. So first we need to assess, it must be a personalized, customized breathing technique program, or the science of breathing is a beautiful breathing whole process. That's what we do it in our place too. So what happens is, first I would say, to simply say, in order to keep your lungs healthy, have you ever focused on your breath? In the sense, to start off, just see whether you need to have, I'm taking my breath in, keeping my breath out. Just stay with the breath. Do not do anything else. Just start staying with the breath. In a day, keep doing it as frequently, as many times as possible. Then you start realizing that you're breathing. Because till now, we have never focused or never thought about this breathing. So once you start staying with the breath pattern, so this is not, it's just a starting stage. That is, you're an LKG student trying to know what is breath, and you've stayed with the breath, and now you go to the next stage of breathing. Because I'm taking you to the various stages, because I'm not going to teach you any technique, but I'm just going to say this is how the various stages of techniques are to be. The next thing what you need to do is you have to maintain correct postures for breathing. If you do not maintain correct postures, you're totally lost, because you need to have your body straight. You need to have your head straight, and just try and see how many minutes you're able to stay in that posture. First, at least try to sit in the chair. Ideally speaking, you have to put in the lotus posture. Many of you, I'm 100% sure, you cannot do a lotus posture at all, and they'll be starting to wriggle around. That means before going to pranayama, get your posture right. See where you have to go, because this is where it is. And if you don't have your posture right, and if you start doing pranayama, it is not going to give you any good results. It is like, I'm going on a walk every day in the morning. Is that sufficient? Is the question which has come up. Then I would say, if you're going on a walking spree every day, but if you don't have the correct technique of breathing, the effect of the whole walking process is entirely waste, because they're done wrongly. You should never do that. Before going in for your walking spree or running spree, make sure that you've got a correct technique of breathing. That is the complete breath. You need to have your abdominal muscles, the chest wall muscles, and your collarbone muscles all in a smooth spectrum. Once you have tested this, you've stayed with your breath, and you're focused on your posture, then I would say, go into saying how many times you're able to breathe per day. Normally what people say, or the literature says, is you need to do at least 16 times. One normally breathes 14 to 16 times in a minute. That means in a whole day, you're taking around 21,600 times breath in and out. Just imagine, if you're taking this 21,600 breaths in a wrong way for a day, just imagine for the past 20 years you've been doing the wrong techniques. Just imagine how your chest wall muscles have got used to it, and they're always wrong. So you have to do a total corrective action to this. So that is where the whole thing starts. So you have to go back to square one. So now, assuming that you've calculated it and you've done everything, so there is something called as the complete breath, which I already informed you. We can go more and more into it on a later date, because it's a constraint of time. I'm just giving you an overall view. And next you go into something called as the cleansing breath. Cleansing breath, because studies have shown, in fact in the Massachusetts General Hospital, they found in order to increase your total lung capacity, what you need to do. They're given two exercise patterns. One is the abdominal breathing, what I said, there's a third type of breathing. And they said there's something called as pursed lip breathing. Because you've taken a deep breath and you do your mouth like this and you leave out your breath like a pursed lip. And if you leave it, take it, leave it like this. But don't get exhausted. Don't get excited and start doing rampantly. All these techniques has to be done in a smooth, non-effective, non-troublesome, you should not get worn out of it. You're trying to rejuvenate your body and nerves. That is how you should do. And you're basically focusing on the lung capacity. So this is your cleansing breath. So has anybody done studies on this? Yes, there's an article which is published in 2014 which says they called all the medical students and they gave a couple of breathing techniques. They called Nadi Shuddhi, the Kabala Bhakti. I'm not trying to say away names so that you get carried away. They taught 4 types of exercises and they did some basic tests to see whether the total lung capacity increases. And they found amazingly that the entire parameters of total lung capacity increases. Total lung capacity. If you're able to increase the total lung capacity, your surfactant gets produced. If your surfactant produces, your lung alveoli doesn't collapse. So now, what is all related to COVID-19? If assuming that you've been doing a wrong type of a breathing process, that means many of your small bulbs of alveolar sacs are not being utilized. They're already in a collapse state. When this COVID-19 affects those things, those alveoli, they cause more secretions, they immediately spread to the adjacent organs, causing more and more collapse. That is why these guys go into susceptibility. And they become more affected because they're not able to. For knowingly or unknowingly, for people who are not getting their lungs affected, they're doing something right, maybe the breathing capacity. If you see many of the Indian people, many of them are in the roads. They're not doing, they're hard workers. In fact, hard working people somehow or other have a total lung capacity which is very good. Total lung capacity improves surfactant. So that is helping them maybe. That is why it is. So now what we are doing is we are all more of desktop jobs. And obesity is one which also doesn't make use of the lungs fully. So obesity people, please make use of. Smokers, try not to smoke. Prevent smoking, because you try to improve the lung capacity now. Because if the more and more the alveolar sacs are improved, I'm sure that we can prevent the COVID virus affecting the lungs, because you may get infected, but at least you can prevent from getting into the stage 3, stage 4 types of lung disease and succumbing to the disease. So now, having said these things, now there is singer's breath, there is nurse stimulant breath. There's so many types of breathing patterns that we can go on talking about it. But this is only, I'm just talking about superficially on the breathing pattern. Once you have done this, now I should also touch upon certain dietary habits which can help the lung immunity, because it is not only the lung collapse, the lung immunity also has to go up. I think many people would have spoken about it. It's just the vitamin C which has to be there, because vitamin C helps out in getting the immunity up. Vitamin B6, vitamin E, vitamin A. I mean, if you just Google all these things, where you can see that what are the diets that is helping us out in helping out the lung immunity, this is what you need to do. Selenium helps you out. Some of the vitamin tablets, vitamin B6 complex with zinc selenium combinations are available, which helps to build up your immunity. Because the lung is one aspect, the immunity is another aspect. So you need to combine these two in order to fight this kind of COVID-19 situation. Another important factor which can decrease the lung immunity is, it will be very surprising if I'm going to say this, there is something called the anger, fear. A lot of people are scared when you talk about COVID-19. Well, is it going to affect me? Will I get trouble? They get into fear psychosis. Fear decreases your immunity. Fear affects your breathing pattern. Fear literally kills you. So take away the fear from it. So there are, it's very breathing in and breathing out itself to take away, it will keep you more relaxed. And jealousy, hatred, a mind, because if you see the mind is a total controller of us. So if you don't keep the mind stable, if it's going on in a monkey way, hanky panky, that also affects the immunity part. That also affects your breathing part. If it affects your breathing part, it is going to affect the whole lot of problems. So it is a vicious cycle. We are creating your own vicious cycle. There are certain things you cannot prevent. The pollution part, I cannot go and say, all of you, please carry the meter to find out what is the pollution in the area and start doing it, because everywhere there's pollution. At least certain things that you can control, I would say definitely we should. Out of which your mind and your fear, your don't get too much excited, don't get too much sad, because sadness, depression, because the comorbidities for COVID-19 is all these psychological symptoms. Psychiatric people are more affected. Diabetes people, because diabetic people, the immunity is already less. Diabetic people, the surfactant is already less. And heart attack patients, those patients are also more susceptible to COVID-19 kind of a scenario. Never ever forget sleep. Sleep is a very important aspect to make sure that you have your immunity up, and during sleep also your breathing pattern. So for that you need to really train your mind how it is. Some people have got a natural thing of a sleep, to sleep soundly well. Many of us do not have a sound sleep. A sound sleep is absolutely necessary. When I say sound sleep, what does it mean? Even it can be a shorter nap. In fact, Napoleon Bonaparte, the Napoleon. So he was a sound sleeper. In fact, sleep was under his control. He could go into sleep for a short nap and come back. Many with a whole kind of a vigor, and then say he will do it. So that kind of a sound short snap also will help us out. In the sleep pattern, I would like to mention a little bit, because there is a wakefulness stage of sleep. There is a dream sleep, a deep sleep, and that sound sleep is the one which I'm looking out for. Because even the dreaming sleep, because many people have the dreaming sleep, that is also not going to be, because once you have the dream sleep going on for hours together, that means your immunity is getting affected. So it is not a good thing, because even after having slept for 8 hours, say with a dreamful sleep, you will still feel non-energetic, you will still feel tired. But a sound sleep of even 10 to 20 minutes can rejuvenate you totally, and you can come back to normal. Some people have got the knack, because they will have a prescribed time frame of sleeping only for 4 to 5 hours, but that sleep will be deep sleep. Mahatma Gandhi had a very sound sleep. In fact, Jawaharlal Nehru had a sound sleep. Current Prime Minister Mr. Modi, he's got a sound sleep, because they got a natural tendency, and it's all a habit. A habit you have to develop. Each one of us have to develop to have a good lung health, lung healthy capacity. And to touch upon a little bit on the dosha, because there is a certain amount of because the lung constantly keeps secreting certain liquids, and the liquid has to be expectorated out. So people who have got the Kabam dosha has got a greater propensity for getting affected with COVID-19, because their secretions are not getting cleared out. Again, it happens in obese people, again people who are lethargic. That is what this you would have all heard about this Kaba Churnam, which is available now. So that helps out to bring out the secretions out. So that is what. So the doshas. So if you have a kind of a dosha, then you have to balance this kind of a dosha to create a lung which is healthy. So certain yogic postures or asanas can help you out to get rid of, to increase your total lung capacity, and thereby you can get your surfactant really high up. With this, I think I've touched upon most of the aspects, and I think we can have some questions if we can just write out some questions. And I think with this, I think my short talk on the lung stimulation or the lung healthy part is over. Yukti, I hope I have answered your question, or do you have any other doubt? Because you have kept saying how it reaches the lung end. So just to keep the whole thing a little bit more on, the vaccines and all that, I think the vaccines are going to take some time. It is not the be-all and end-all for the entire thing, because when influenza started coming, in fact there's a lot of relationship, they thought that vaccinations will help, and in fact every year they had to give flu shots, and because it changed its strain every year. And in the COVID-19, if you see, within the short period of 5 months, there are so many strains and mutations that have happened. That means it is changing its thing so quickly that even if a vaccine comes, it might not be the be all and end all. The best way to get thing is get your lungs more healthy, and do whatever is healthy to get your lungs up. And whenever you have in a day time, it is not like you have a fixed timing to do the lung strengthening or lung healthy exercises. You just have to do it as many times as possible. Be aware and do the complete breathing part perfectly. Another important thing which I forgot to mention was the hyperbaric oxygen therapy. Hyperbaric oxygen therapy is now, whatever we are breathing now is in the normal breathing surroundings. There is a normal atmospheric pressure, and hyperbaric oxygen chamber is where you are placed inside a chamber where it goes to 2 times or 3 times atmospheric pressure, and when somebody is placed in that atmospheric pressure and when oxygen is delivered, the oxygen perfuses or opens up. That is when I say total lung capacity. It makes use of the total alveolar spaces available, pushes the lung, pushes the oxygen into every bit of the lung, and thereby increases the perfusion. That is exactly what 100% of oxygen. That is why when hyperbaric oxygen people, what we give in my clinic is, when we say to the patients that you're getting 100% oxygen. So they say, sir, even when you put that small meter, it says 100% oxygen is. But it is just that whatever portion of the lung you're using, that is itself is giving 100%, but you are not using the entire lung properly. So many centers in the world have started giving hyperbaric oxygen therapy for patients who are in the third stage of whatever I said, where the lung starts collapsing and people are finding to have a difficulty in breathing, and that is where they found that the giving hyperbaric oxygen therapy, the lungs quickly expands and the surfactant is produced, preventing further collapse, and people are able to tide over that event and come back to normal. So hyperbaric oxygen therapy in selected individuals really helps us out in these kind of acute situations. So good that we mentioned that. And I think with this, I think I've given maximum kind of an information on what it is, and describing each part of the yoga postures and asanas. This might, because it has to be one-on-one, because we need to assess you before seeing what kind of a breathing exercises, what kind of a posture. There's a whole lot of postures that you can do, and not one single method or not one single technique is sufficient for everyone. If that was so, it can be easily percolated into the people and then say this is what I need for. It has to be tailor-made and it has to be customized for that particular individual, how best we can do for you. And the just to keep adding a little bit, like in the breathing part itself, once you have started inhalation, exhalation part, then you have to go to the inhalation, holding the breath a little bit, then leaving it out. Then there's something called as rhythmic breathing, where you have to do the breathing in close relation to your heartbeat. There is something called as walking pranayama. Pranayama while walking, that is the best. If all the people who are walking in the parks, in your roadside, if they can combine this walking with the pranayama technique, that gives them the maximum benefit. Why still many people are having problems? Because again, when you inhale and exhale, your heart rate changes. When you inhale, your heart rate decreases. Your heart rate increases. And when you exhale, the heart rate decreases. The same way, your blood pressure. When you inhale deeply, your blood pressure decreases. So there's so many intrinsic mechanisms that are happening in between, and which we allopathic doctors read on a day-to-day basis in the term of physiology. But when it comes to the real application, we need to fall back on our older systems of medicine, because knowingly or unknowingly, they have written all these systems. So my main job was to see how I can use the older medical terms, older kind of a medicine, how I can apply it to the current world, because the current limitations of allopathy, many of the allopathic doctors know that this is what the limit is. We cannot do anything beyond this, because still research is going on. But we can adopt some of the things which are already available, bring it back to the whole system and see how we can take this further, because now it looks like we have to live with the coronavirus. It just doesn't mean that the lockdown goes, the corona goes away. It is going to be a process. We have to live. It is going to be part and parcel of our life. If that is going to be part and parcel of our life, how best we can stay away from it. It will still be there, but I need not get affected. That is, the best way is to keep your lungs healthy. In order to keep your lungs healthy, breathe healthy. Learn the proper techniques. Do it. It is not like you go for a course for 2 days. Learn this technique and come back. If you do not practice, any short-term course is a waste. It's a process. It is like from first standard, you go to second, you go to third, you go to fourth. That is how it is. So the normal process of breathing, inhalation and exhalation, which I said, it has to be practiced for at least 4 to 6 weeks, because you need to master the technique before you go to the next. You cannot learn a series of breathing techniques and I say, now I have done these breathing techniques. Trust me, you will not be able to do all the breathing techniques in one day. So you need to master one by one, master one by one, master one by one, and then you can go into, because before I came into the process of the cleansing breath, or something called lung cell stimulation breath, which I've been doing for quite some time, because it took me like roughly 6 to 9 months. So now I can do the lung cell stimulation breath to some extent, to a reasonable level. Still I have not mastered it. Day to day, we should master it, combining it with certain yoga postures, and that is how I mean we need to be able to combine both. Again, in the busy schedule of us, I mean, you need to find some time in between work, 10 minutes of in between work. But do not do your pranayama after a heavy meal. Never. Always do it before, because you need to have the stomach empty before practicing these pranayama techniques, till it becomes part and parcel of your life. And that is what we need to focus on. So I think I've given sufficient information on staying lung healthy, and if there is, I'll be very happy to answer some of your queries if you have any. Aniruddha asked a question saying, as you're someone who's a consultant in many hospitals throughout the city, can you please tell us which all private hospitals are currently admitting COVID patients for treatment? Ani, it's good to see you in the question answer session and taking part in this live session. So yes, certain hospitals, especially Apollo, Kaveri Hospital, I mean, many of the private centers have dedicated some of the patients for the COVID. They created a COVID ward. In fact, every private hospital, basically with the ventilator support, have been using it, and they are doing it. But if you see, the maximum number of patients are coming to the bigger tertiary centers. It's not necessary for them to be in the tertiary centers. They can go to even smaller hospitals and where ventilator support is there. And in fact, Yukti has asked, saying that how effective are ventilators when the lung failed to work effectively? This is a fantastic question. In fact, if you see ventilators, people who have been put on ventilators, unfortunately, many people have succumbed to the disease. Because ventilator, you're not allowing the patient, because when you put a patient on a ventilator, that means you're totally leaving control of the person into a machine. So what they found is, by a CPAP, that is where you don't leave the entire system to a ventilator, it's a patient's own effort plus additional support like a CPAP has got better results. So ventilator is still being used only for very extremely down, but once a ventilator is on, I think you're going to lose this patient, and very few patients are able to come out of it. So I think this is what the learning point from this is. So another question which has come is, sir, does Amit has asked, sir, does anxiety affect breathing? If so, how can one control it? It's a fantastic question. Whenever you're anxious, if you see, your breathing pattern changes. To be aware of it, trust me, you have to know that you're breathing first. So your breathing increases. You take short breaths. That is not knowingly or unknowingly you do short breaths. When you take short breaths, that means you're not reaching your total lung capacity. When you're not teaching at total lung capacity, that means many of your alveoli are getting collapsed. How to get over anxiety? It is the mindfulness state of living, which I think I should talk to you on a different day, and because it's a whole process. How to win over anger, how to be mindfulness, how to win over anxiety, how I can keep my mind under control. Because once you know how to keep your mind under control, trust me, many of the other problems can be curtailed. So I will not be able to talk to you on the entire spectrum of how to control it. It will be very, very difficult for me. But yes, you can. Anxiety definitely affects it, and it really gives us a problem. Again, Amit has asked me, sir, this is from my mom. Can high blood pressure affect your breathing? High blood pressure does not affect your breathing directly, but high blood pressure causes certain other problems by which, high blood pressure is, for instance, it will not affect your breathing directly, definitely no. But high blood pressure patients are succumbed to COVID-19. That's why there's a direct relationship between hypertension and the thing. It's still studied, and I will not be able to answer that question directly to you. Anup Kumar, hi Anup. I normally have sneezing in morning every day and have nose blockage. I do have running nose. How to improve on it, sir? Yes, Anupji. So it's a very important question. Sneezing is, the best way to get out of this is, in fact, if you see, every one of us who are nostril breathers and not mouth breathers, okay? When I say nostril breathers, that means you're breathing through your nose. If you carefully watch, every 1.5 hours, your breath changes between the right nostril and the left nostril. To simply check it is, if you see now my right nostril has got little obstruction, so I am predominantly a right nostril breathing as of now. If I check it after some time, it will be the left. So normally itself it changes between the right and the left nostril. So when you have a nose blockage, try to close the nostril which is flowing normally, and try to take in nice in and out breaths through the nostril which is blocked. The nostrils will clean. In case if you're having both the nostrils blocked, try to open up one, because you cannot have a totally stuffed nostrils on both sides. One will be literally free. So try to get that nostril released. Suppose if I have both the nostrils knocked, I'm going to check which side is easier. If I feel that my right is, try to get this opened up first. And if you do this, and you have to have your breathing technique. If you do it for at least a couple of days, you will find that the amount of nasal blocks you happen will decrease, and slowly over a period of 3 to 6 months, your sneezing episodes will come down. Trust me, it does happen. And very useful for asthmatics. And so this is one, and I'm just going through the questions where people have asked how effective ventilators, anxiety. Yeah, so I think most of the questions I've answered which has been raised. I suppose. Thank you, Dinesh. Thanks for your. So many people have said there's information. I don't know, because many of you, I'm sure that you would have known this. It is just this forum has made me to collectively make you rethink about the whole process, because it is just not that I am knowledgeable, great thing over this, and I got the best of knowledge. It is just that I wanted to keep this, give it a small thought. I would like you to ponder over it, because there's some breathing techniques that has been evaluated so long, and ponder over it. Do not give it, say, okay, this is some talk on breathing. Do not leave it off like that. Ponder over it. Do your research on that. And then when you come back with your many questions, I'll be very happy to come back on to answering a lot more questions on this, because I just given you an overview, and we need to be one-on-one to see how best I can get you through the whole process so that I can keep your lungs healthy. Thanks, Anup. Thanks for acknowledging your wishes, and so if there are no more questions, and I hope you would have all gained some knowledge at least in this, whatever I could transmit, because I wanted to keep it a little bit more simple and effective for all of you. So thank you once again, and with this session I really thank Dr. Natesh and for his organizing team, and Dr. J.S. Rajkumar, Anirudh, who have been my very close colleagues and friends for so many years, for giving me an opportunity to come on this Lifeline Hospital live video session and share a few thoughts on how to keep your lungs healthy, so that we'll be able to stay with this and fight against this corona much more effectively. We'll keep our lungs healthy and strong. Thank you.